I will, speak a bit about what Professor Bala Audu just spoke about in terms of some of the motivating factors that makes people to want to migrate, overseas. And, one of them is lack of facilities, right? So you're a medical doctor, you train to provide certain services. And when you want to specialize, you feel that, those facilities are not available. Sometimes you don't have enough openings, for you to do training also. You also don't have enough manpower around you to support you if you decide to actually go into, working in Nigeria. In addition, let's not, run away from it. Money is quite important. You have to look after yourself, look after your children, look after your extended family also. And if you feel that, at the end of the month, the amount of money you make is not sufficient for you to survive and to take care of your immediate family, then you start thinking about going overseas, whether within Africa or outside Africa, to seek for greener pastures, as we say. And most of the people coming to Canada, I think they fall within that particular category. People are also really determined to learn, to expand their skills. They want to be in an environment where they have access to, first world facilities, first world experts, as well as the ability for them to navigate a system that doesn't have a lot of roadblocks or bottlenecks for them. My personal experience is I left Nigeria a long time ago. I first went to South Africa, where I went and I specialized in family medicine there. And that was a very good training ground for me for a while. And afterwards, I moved to Canada, which, that's where I am currently. And I'll tell you that the difference is really quite remarkable between the practice, what you have in South Africa or in Canada compared to what you have in Nigeria. The independence you have, the facilities, the support system, the government provides that support for you here for you to succeed. I mean, we also have some concerns in the healthcare sector here in Canada that we wish that the government will really improve on. But when you compare them, right, Canada is really, on a different plane compared to Nigeria. And I believe that it's not the end of everything. I know that probably you talk about this later on, but I believe that there are mechanisms in place to sort of repatriate some of these skills back to Nigeria to help the healthcare sector to boost it and to ensure that our colleagues working in Nigeria, they get the support that they need from those of us that left the country, many years ago. And a lot of us do come back to Nigeria to work in various hospitals. Some have set up a lot of very, very world-class facilities, in Nigeria, particularly in Lagos, I must say, and they are doing very well. And we have a number of them who are willing to actually come back to Nigeria to bring back those skill sets, that they've learned here in overseas. If you're talking about a partition of skills, I was fortunate to be in a meeting where the Minister of State for Health, Dr. Tunde Alausa, did a presentation in America recently, and he had some government officials with him also. And I must say that the government has a robust plan to actually improve the healthcare sector in Nigeria. And they are looking at the diaspora, doctors, healthcare workers, nurses, pharmacists, to be part of that plan. And when you have people who actually work overseas, they're now working in Nigeria. These are technocrats, people who know what it takes to deliver a good healthcare service. Then you want to look at what the plan is and how you can actually, support them. Yeah, I'll just stop for now. Thank you.